Traditional dentures have been around for years and years, and they work as long as you have enough bone structure to keep them in place. They stay in place by basically suction. If your bone has deteriorated to the fact that basically there's not enough left for the denture to make that suction to stay in place, then replacing the denture is not going to do anything for you. It still doesn't have anything to adhere to. Placing implants give the dentures something to grab onto. By having the implants in there, it stabilizes the denture, so it basically is attached to the denture, and that attachment gives it enough retention so when you eat and drink and talk to people, your dentures don't fly out of your mouth. If you would like to find out if implant dentures are right for you, please give us a call for a free consult. We go over all the options that are available to you, and that way you can make the best decision for yourself.